Good morning, everyone. I would like to call us to order. I'm Caswell Evans, co-chair of the Global Forum, and on behalf of my fellow co-chair, Deborah Powell, we welcome you to this workshop on systems approach to alleviating work-induced stress and improving oral health. I'm a dentist, so. Improving health, well-being, and resilience of health professionals within and beyond education. We have a full room here. We also have overflow rooms for many of the public invited guests. So I think we have a very exciting workshop before us. I want to thank all of the sponsors who help make these workshops possible, particularly the Georges Foundation for its support. And I will then turn the proceedings over to the workshop co-chair, Zohray Talib, and Zohray will move us forward from this point. Sorry.
Thank you, Caswell. So welcome, all of you. It is an absolute pleasure to welcome you all to this exciting workshop, which has certainly convened a diverse group of thought leaders who are interested in this topic. We come together today for this workshop, day and a half workshop, but it has been over a year in planning. Thought leaders from different sectors, from different health fields have been convened together as the planning committee, many of whom are sitting at your tables, and I won't go into who they are and their exceptional bios, but when you encounter those with the name tags, please engage in conversation. They're exceptionally thoughtful about the topic we've come to gather on today. So over the course of the last year, we've had many conversations. The topic is broad, exceptionally relevant, exceptionally, in some sense, urgent to address. And one of the key milestones of this effort was a discussion paper that was published by the working group in January of 2017. And it was called A Multifaceted Approach to Addressing Stress Within Health Professions, Education, and Beyond. And you have it in your package. It nicely lays out a framework for a broad topic. But when this planning committee came together, we thought, okay, we know this conversation about stress and burnout is happening in many spaces, in many places, locally, globally, among different professions. What's unique about this space, about this group? What can we bring that would be added value to the conversation on stress and burnout? So as we thought about stress and burnout, and as this group thought, what is the value added we can bring? There were certain elements that came together. So first of all, we sit together in the Global Forum and in this room as over 19 different health professions gathered. That in itself is a unique space, and that is what makes this conversation particularly unique. We're also taking a systems approach. So one can approach this as an individual and how one might personally address stress and burnout, but this is necessarily or thoughtfully a systems approach. And third, that we're coming at this, many of us, or all of us in some way, as leaders in the field. So an interdisciplinary, multi-sector systems approach to stress and burnout in the health sector, stress and burnout among health professions, education, and in the space of both education and service. So as we sort of formulated that thought, that's sort of the value-added perspective we'd like to bring, the group conducted a series of interviews with over 40 different leaders in not just the health sector, but in different sectors to engage in this conversation to really better understand the issues. And as a result of those different interviews, we have shared with you a discussion paper that's in your booklet, and I hope many of you have had a chance to reflect on that. And what did we learn after these 40 different interviews and conversations, many of whom very rich conversations? We learned what we probably all realize is that stress is ubiquitous. It's so ubiquitous, it's almost inevitable. You know, whether it's the nursing sector, you name it, any health sector, any field was struggling with health and with stress and burnout. It's a local issue, it's a global issue, and it affects those early in their career and even those late in their career. And even myself, as I was reflecting, I'm a primary care provider here in the Washington, D.C. area. I'm certainly sensitive to what it feels, the stress and burnout feelings of providing care in the U.S. system. But I also teach family doctors in the mountains of Tajikistan, and mindful of the physical challenges they have to encounter as they go to work. And I've worked in the rural parts of Ethiopia and think about those meager health clinics with very poor resources and the struggles they face. So stress and burnout is really just a ubiquitous issue. The other thing we learned is the types of stress are kind of ubiquitous almost throughout the health system. So what are those stresses? There's stresses of the financial stresses, there's stresses of infrastructure, there's even moral stress and compassion fatigue and hierarchical issues, power issues. So this stress even manifests and it's triggered and it's catalyzed by different things. So it's quite a broad, it manifests differently, it manifests broadly, and there are broad triggers for this stress. Most importantly, I think as we interviewed and spoke about this issue, we thought about, so why does it matter? If it's so ubiquitous and it's so inevitable, should we just accept it as part of life? Or should we try to address it? And what's the case to trying to address it? Either adding more resources to address this issue or shuffling resources to address this issue. Well, it certainly matters, and I'm sure that all of us agree, but some of the things that came to light is that it matters because it affects patient outcomes and experiences. It matters because it affects health workforce turnover. And not just in the way that health professionals interact with the patients, but it affects their ability to be retained in a job and the impact of that, both in terms of dysfunctional teams and the cost of replacing health workers. So there's impact on the patients, there's impact on the systems, and most importantly, I think what often drives change is there is a cost impact. There's an impact not just to replacing, recruiting, reorienting new staff, but when staff retire early or reduce clinical hours, the medical errors in the system. So there even is a financial bottom line to this issue as well. So clearly there's an answer to the so what. It does matter, and it matters on many levels. So how do we intend, or what is our objective for the workshop here today and the next day and a half? Well, we recognize you're all here from different spaces, different places, different lens. You all come to this workshop with a different lens. What we're hoping we can achieve over the next day and a half is to provide seeds of different examples of how others have addressed this issue. But more importantly, we're hoping that you take a lens back with you of how you might address this issue in your own space. So we'll hear about design thinking, an approach to issues that's human-centered, that looks at the person and the problem first, and then backs out into how would that issue be addressed. And it nicely complements another approach, which is a systems approach, which looks at different pieces of a system and how those work together. And my co-chair will talk more about these different approaches. But what we're hoping is that you take nuggets of ideas, reflections over the course of the day and a half, and this design thinking approach so that you go back to your spaces of work and think about how to engage your colleagues in this exercise, in this human-centered exercise around addressing stress and burnout. After the workshop, we hope this is not the beginning and the end. After the workshop, we hope that you carry on the conversations. If you look through the agenda, there are thoughtfully placed spaces for networking. Engage with your colleagues, take their cards, and continue that conversation. This workshop is webcast. You can share with your colleagues speakers and topics from the day that were of interest. And there will also be a dissemination event in October of 2018 in Irvine, California, where the proceedings of this workshop will be shared. So there will be ample opportunity to continue this conversation, and that's really our hope, that this workshop is a catalyst for future conversations. So with that, let me introduce my co-chair. It has been an absolute pleasure to work over the course of the year with Mary Jo Kreitzer. Mary Jo is the founder and director of the Center for Spirituality and Healing at the University of Minnesota, where she also serves as a tenured professor in the School of Nursing. Within the School of Nursing, Dr. Kreitzer is the co-lead of the Doctorate of Nursing Practice program in Integrative Health and Healing. That's the technical bio, but let me tell you, she's a thought leader in this space. She's a practitioner, she's a teacher, she's an advocate, and she's really brought incredible value and creativity and energy to this workshop planning. Thank you.